Willst du mitkommen? Oder? Ja. Are you ready?
Yes.
So welcome everybody on this Saturday morning. It's a big pleasure for me to be here, and we would like to introduce us to you. So this is Michaela Wolf. She is head of the clinical training center of Zimmer Academy, and so she's the best person to ask any questions about the devices. She's very experienced. She knows all the devices, and if you ever in the future have some special demands or questions, she's the best person to contact because, as I said, she knows everything. And my name, so she's Michaela Wolf, and my name is Jörg Faulhaber. I was trained in dermatology, and I was professor at the University of Heidelberg in Germany, and I have a private office or practice near Stuttgart in Germany, so the southern part. And I'm working with Zimmer since maybe 10 years or 15 years, so a long time. And I love their products because they are very reliable. And for me, they have a very good price relationship to what they offer. And so I'm connected since a long time. And sometimes we have the pleasure to travel to some places and to talk about the devices. And if you ever have a question, just don't hesitate to answer. I do not want to take the beach or the sand to the beach. So as you are all very experienced, I just want to present. We want to do a little theoretical or an introduction this morning for maybe 1 or 2 hours. And then in the afternoon, it's like more hands-on. Then that you maybe can also work with the products and we can have a look at them. I think we have 2 models we can treat together. So it should be like a little bit theory and see one, do one, teach one is our motto. So this afternoon we are going to do a little training, and as I said, you can also, if you want, take part. Okay. And it was a great debate already last night how we start, and we decided to start here with the Z wave. If you ever have a question, just ask me. And if I'm too slow or too fast, also remind me and interrupt me. And do you know the Z wave? Does anybody work with the Z wave? Okay. The Z wave is basically a handpiece and a device that is generating shock waves. And they have a penetration of about 35 millimeters into the depth of the body. And the energy is generated by an electromagnetic field via a handpiece. I'm going to show the machine to you later. And the basic mechanism is this, that a projectile is accelerated through a field and is bouncing in the handpiece in the applicator head, and that is generating these shock waves which are radiating through the body and through the tissue. So it's like a bullet, let's say, in a gun. And it's like a ballistic shock wave, and it is a very, very good method because it's versatile for the improvement of cellulite and any weakness in the connective tissue. So if you have like striae or even cellulite, this energy is inducing collagen production and is improving the cellulite. You should not be confused with ultrasound because it's not an ultrasound. And initially, because Zimmer, many, many years ago, when they were founded, they are 50 years old, they started with physiotherapy equipment. And they had like shock waves for the ankles to treat. And these were the first machines they were building. And in the development, many years later, then they developed this special focused shock wave to treat those, not the ankles in the depth, but a little bit in upper in the skin area, in the fat tissue. So this was the history. So they usually did the physical therapy stuff for injury, trauma, or surgery, and then this was a second application. You can also use it to clear edema or lymphedema in damaged tissue or after surgery or something like that, because as I said, it's inducing collagenesis and angiogenesis. It is FDA approved for cellulite treatment, and as you know, cellulite is very hard to treat. And what I do basically in my office is that the patients come once a week for 10 or 12 sessions, so or 10 to 12 weeks, and usually the assistant is doing it because it's a very safe method and you can delegate it. You do not have to do it by yourself. So this is the way I do it. And then you charge them per session. We charge between 20 and 40 euro per session, but you can adapt it as ever you feel to what you want to do. And another indication besides the stria and the collagen is when I do the set lipo, so cryotherapy for the fat reduction. I do for 1 hour or 45 minutes the cryo, and then I put the set wave over it, because the shock waves are supposed to reduce the edema and enhance the lymphatic drainage. And for me, another mechanism which is very important is if this is the adipocyte, and if you freeze the tissue with the cryo, you have like crystals, ice crystals inside. And these edges are very sharp of the ice crystals. You know it from the winter time when they peak on your skin. And if you do the shock wave, you set the adipocytes in motion, and so the sharp can destroy the membrane of the adipocytes, and for me it's enhancing the destruction of the adipocytes. So I combine it. And the patients are very happy because you have like a massage afterwards. This is not hurting, it's nice, it's inducing the lymphatic drainage, and you do something good for the mechanism in addition to the cold. So this is the second very interesting indication. I use it regularly in every patient. Okay. Contraindications, you want to hear? Real quick. Vascular diseases, local infections, malignant tumors, it's everything the same. Normally the patients should be healthy, or they are actually healthy. If somebody with these problems come, they are not healthy and they have other problems. So malignant tumors, or if you have some joint cartilage or something like that, pregnancy, of course, blood coagulation disorders, or if you take medications for anticoagulation, neurological diseases, lung, heart, of course. So the normal stuff, you would not do it. Okay, we have 2 handpieces, which makes the turnaround in the office is more quick. I show it on the picture to you. And, okay, the nice designs. You can do 2 million shots, which is very nice. You have the memory card, and the hand piece is really very nice for the treatment. And as I said, I usually delegate this treatment because it's safe and you save time and you make money while treatment with somebody else. So the effects are basically a mechanical and biochemical lipolysis. Fibrotic structures become softer. You induce a kind of liponecrosis. You reduce the size of the fat cells. You have a large vasodilation. You have an improvement of blood flow by formation of new blood vessels. And as I said, you have a very, very good lymphatic drainage effect and the washout of the toxins. And this is basically the Z wave, and you have here the two hand pieces which you cannot use together, but you can use one on the one side and on the other side, or you use one for the first patient and then the second for the other patient, and meanwhile the used handpiece can cool down and get ready for the next patient. And you can really very nice combine it with the cryo therapy device. And there's one addition I would like to mention, which is very interesting, and I'm not treating it. Maybe you have some clients. This shock wave is very, very good for ID. So you have a focused version of this shock wave, and Michaela is working with some urologists together. And if you have this erectile dysfunction of the penis, you do not have any good treatment. And when you use this shock wave, you really significantly enhance the blood flow and the angiogenesis. And its one of the best indications, if you have patience for it, to treat it. And it's very, very simple. Maybe you want to mention the...
Oh, it's on. Okay. Wanted to add some arguments for the shockwave in general, because why we are using shockwave in the aesthetic is in every case we have the increase of blood flow, short term and long term, and this is really nice because we can have a lot of combinations. We can use shockwave for indications, medical indications like erectile dysfunction, increase of blood flow, revascularization, and all in the aesthetic for all the other aesthetic treatments like cryolipolysis, radiofrequency also. All this kind of body contouring, I think that's a very good additional device for all the other aesthetic treatments. Radiofrequency and
you can even use it in the face when you are...
Yeah, and the good news, I said often to our customers and distributors as well, nothing can happen because we cannot have any side effects, because shockwave is, as a radial shockwave is very easy. I think you agree with me. You can delegate this to the medical staffs, and nothing can happen. We cannot have any side effects because in every case we have the increase of blood flow and no side effects. In our risk analysis of maybe 100 patients, so we got one hematoma and one redness, that's it, and this is nothing. Yeah, that's the good news.
Yeah. So it's very safe and for delegation. Yeah. Okay. So this is a summarization of the settings. So cellulite is for me the top indication, and the combination with cryolipolysis. We also have used it for combination with radio frequency. You can combine it with ultrasound or soft lasers. You can use it in aesthetic scar treatment, supporting lymphatic drainage after surgery, for example. And you can use it in stretch marks, in stria distensae. So this is basically how the display looks like, and it's having set programs, so it's very easy to select them, to delegate them, and you can not do any mistake. You only have to define the region, and then off we go. It's really very simple. You see, you have here the upper arms. You have here the already programmed pulse energy, the frequency, and then you just kick the start, and then off we go. And it's stopping automatically. Yeah. So it's really very easy and safe and easy to handle. Here are a few pictures from the cellulite treatment here before and after. And it's one of the best methods I know to treat the cellulite, which is very difficult. And it's hard to promise the effect and the outcome in cellulite treatment. So this is having very nice effects. And you do it once a week for like 10 or 12 sessions. And here you see some ultrasound pictures, which were made from the superficial skin. And you see how before you have here those leakages in the cellulite area, and you induce the collagen tissue and make it more strengthen again, and induce angiogenesis and the collagen production, and that is the basic mechanism how it is working. And this is a heat map, and you see before the blood flow here in the skin, and this is after the treatment, and that shows what I already said with the vasodilation and the increased blood pressure, blood flow in this area. How you increase it with the with the energy, with the shock waves. And the shock waves are radiating basically from the point where you can really nicely slide it, and they radiate from the center in the periphery. Here, those two guys did a study with cryotherapy combined with only with initial massage, and here to treatment with the shock wave, and they saw it's one of the guys actually, and they saw a much better reduction of the fat tissue with the Z-wave treatments in combination. And here's from Matthias Sandhofer from Austria, is the radio shockwave therapy after cryolysis for cellulite and lymphedema here at the belly, and I did a study with him together, and we had really very, very nice effects, and the effects were better with the Z-wave than alone, so it's worthwhile to do it. You have the fat reduction as well as skin tightening is also improved. And the therapy is basically very pleasant and is not hurting. And the patient is feeling more comfortable. So it's basically fat reduction treatments and collagen inducement in cellulite. You can do large areas. It's easy to handle, and it's having a high efficiency. And you do not have any downtime. You go in the office and get out. They will not notice anything. But it's always good to convince the patients that they should eat healthy and keep moving anyway. Okay. That was the shockwave, 2 million pulses. As I said, food control. You have blue caps on top. We show you later. It's easy to clean and protects patients from it. And as I told you, cellulite, post-body shaping, and liposuction afterwards treatment. You always can do it in plantar fasciitis and tendinitis. Okay, these are some data. It's very ergonomic. You can easily, or the guy who is treating is single-handed. It's very easy to use and very automatic. And yeah, it's a very good tool. Do you have any questions? Is the speed good? So I think it's good to see you maybe later when we try it in the models. Yeah? If you do not have any further questions. Good. Then the second one is the Z field. It's a high energy inductive device for muscle growth and body shaping. Oh, the video? Can you work it from your... Yeah? Okay. And this is basically an electromagnetic field. And this allows about 30,000 muscle contractions through the treatment by the electronic impulses the electromagnetic field is generating. And so you can train your muscles. You have basically one applicator or two you put on the area you want to treat. So most of the time the abdomen or the gluteal area. You have two applicators or a single can be used. Most of the time I'm using two because you have a bigger surface for the treatment, and you can attach it with a fixation belt, and you even have for an applicator for the arm where you can treat the upper arm muscles. And then you do the like 30,000 movements. It's non-invasive, so you do not have any pain. You notice the muscle contraction, but I feel it relaxing. It's really very comfortable. Painless. You have a treatment time from 20 to 30 minutes, and it's very simple operation, so you also can delegate it to your staff if you want. And it's improving the abdominal tone, and it's strengthening the muscles for a firmer abdomen. So it's excellent for body shaping, and you also can combine it with other procedures. And you need about 8 to 10 treatments, 2 times a week. As I said, around half an hour, and you all can repeat it after 3 to 6 months. The top areas are the abdomen, the gluteal area, and sometimes the arms, but the abdomen and the gluteal area is the most mandatory areas in my experience. It's also the software is very easy, and the display is very easy to understand. You only have to set the region. You can use a manual mode if you want to change it, but the regions are very good programmed, so you just have to press on the button and it's running. You do not have to think about or have to take anything into consideration. This is the configuration menu. You have the time, which is ticking back. You have the region, you just play on start, and then off we go. These are the programs you can select. So it's a perfect combination after fat reduction. The basic mechanism for me is that you induce muscle growth very easily with the machine. So the muscle is hypertrophy, and some people say it's doing also fat reduction, and for me it does not induce any fat reduction. Maybe because the muscle is getting bigger and does need more energy. It takes from the fat tissue some fat reduction, but the device per se does not do the fat reduction. It's building muscles and inducing a hypertrophy. And you see, this is from my assistant doctor 2 or 3 years ago. He's a young guy, end of 20s. And we did 10 sessions. This was the MRT before the treatment. And he's quite a sport active guy. And this was the hypertrophy after 10 sessions. We did MRT again. So that you have a huge hypertrophic and defined muscle induction with this with the set field. Here's another clinical picture from before, and it was 8 sessions. I usually do 10 sessions, and he is very slim, so you even can see better the muscle induction.
Sorry, Jörg.
Yeah.
So what also is very impressive is by all our clients, they are using C-field or magnetic field therapy, is you can recognize the more upright position of the body. It's like if you have no muscles on the belly, it's working like you're walking like that. And after 10 sessions, you are more upright. So there's a special study from our doctor in Italy, Dr. Francesca De Angelis. She did very good diagram with the angle, the measurement of the angle, and you can see the improvement of the more upright position of the body. It's very impressive also. Yeah, it means this is more healthy as well for the back, and also we have more muscles. I think that's absolutely clear, and this is also a very good side effect.
Yeah. Yeah. So stabilization is better, much better because of the muscle growth, as you can imagine. Yeah. Yeah. And it's all, you delegate it, and they come once or twice a week for like 8 to 10 sessions, and you do not have to take care during this time of the patients. Okay. This is the gluteal area before and after. Also, you see the hypertrophy of the muscle. So these are the basic stuff. You have like 1 Tesla per channel. You have a fixing belt. You can set the programs with the regions, which just makes it very easy. You have a touch screen. You can do around 10,000 treatments. Yeah. Is there anything else to emphasize on this from your side?
So we are using this slide because to show you what are the main facts or advantages of Zimmer devices compared to M-Sculpt BTL, what is the biggest competitor for us. So it's also a good device, and we have exactly the same technology, but there is one difference, and this is really meaningful difference, because they are using, they cool down the applicators by air. And we are using a very high quality oil. So that's why we can give you more treatment, or let me say, treatment times instead 10,000 instead of 300. And this is also a main fact for the Zimmer devices, to cooling down the applicators by oil. That's it. This is the main difference. So if you have any colleagues, or they are met some colleagues from BTL, both devices are working very well, same technology, but this is the big difference. Yeah.
Okay. Do we need it? No. It's about the red and the white muscle. Yeah.
What do you think? What is the target of magnetic field devices? Why we can create muscle growing? Any idea? Okay, it's a Saturday. It's 11 o'clock. Please help me a little bit. No? Okay. We wanted to reach the most of the type 1 muscle fibers. Type 2 muscle fibers are the deep muscle fibers, so we are working in our daily life with the type 1 muscle fibers. It's like if you get up in the morning, you need type 1 muscle fibers, yeah? And this is our target. This is exactly our target. And then we are working in a very comfortable zone, let me say, in a very healthy zone on our body. We wanted to have more endurance and aerobic type 1 muscle fibers. The target with magnetic field therapy is, kannst du mal weitergehen bitte? Weiter. To create the muscles or the muscle tone is like in your pictures with the MRI. To have a very good outcome with on the muscles after 10 treatments. So, and then what we can do is during a treatment, we can increase the intensity. It means the power to reach more type 1 muscle fibers. It means this is our muscle with a lot of type 1 muscle fibers. And this is our applicator. And the target is during the treatment, we start in a low level, and during the treatment, we wanted to have more intensity. The intensity means if you have more intensity, you can reach more type 1 muscle fibers for a better outcome and also for very good muscle tonus to see this results like in the MRI. This is the functionality or the mechanism of action with high energy inductive therapy. Clear? Okay, perfect.
So the small muscle fibers are the main target.
Yeah. Type 1,
Okay.
sometimes type 2, but
Yeah.
this is not so much like type 1 muscle fibers.
So you always also have improvement of blood flow, of course, the endurance, muscle firming, muscle volume, as I saw on the MRT picture. The strength is improving and also the explosive strength. And you have different frequencies for beginners with 25, 30, professionals 35, or high intensity training with 40 hertz. But you do it like the patient is tolerating. So you also just take the program and you ask them whether it's okay, and you just increase the program and you increase the hertz. And if the patient is tolerating it, it's no problem. When I did it, I just did it on the full power, and it was no problem. You notice it a little bit, but as I said, the longer you do it, the more relaxing it is actually. And the effect is better. So for the buttocks, you have 30 minutes. 30 minutes is in abdomen and buttocks, and the legs and the arms. So the extremities are 20 minutes. And you can use it for 18 to 35 hertz, but it's mentioned into the program, no problem. And you have in the abdomen 25 to 40 hertz. And it's very easy, if you tolerate it, to increase it very rapidly from the very beginning. Okay, that was the set field. Are there any questions? Yeah. What syndrome? So, I do not have any data that it's harmful, because I do not think that a PCO syndrome, yes, that it's not coming that deep. It's only in the muscles. Yeah, and I do not have any bad experience with that. Yeah, yeah, you're welcome. Okay. Anything else? Do you need a break? Should we go on? We go on. So the cryo is an old device, I would say, which was Zimmer created in 1996, and they had 6 versions and I think it's a very old and very well distributed device, and they always improved it. It's very cost effective. You have no consumable costs. You have a consistent performance to about -30 degrees. It does not interfere with medical lasers, so you use it for cooling during our laser treatments. You can have lengthy treatments, and you have a wide variety of applications. And why should Cryo Gold air therapy? It's just a great benefit to the patient, and the patient comfort is hugely increased. You have and this was all done in this, multiple studies, that the pain reduction during skin injections by cold air, for example, is one big field. And for example, you have different temperatures in cold air with different, here it's the pulse dye laser, but in different laser systems, you just reduce the pain and you increase the patient's comfort very dramatically. You also can use it in facial Botox or axillary surgery. You can use it with facial fillers for hyaluronic acid injections, but you also can use it in facial surgery or the body surgery whenever you want to reduce pain. So you can use it in multi treatments. And the treatment benefits is contactless air cooling here from the device. So somebody's holding the device, or you can fix this device, and during that you can do the laser treatments. You have a reduced risk of frostbites. Myself, we never had any frostbites. You have a thermal protection for patient. You reduce the pain and the downtime, and you cool it before the treatment, during and after the treatment. And this is a large increase in the patient's comfort. You can support laser tattoo or hair removal. You can use it for PDT, for photothermal therapy. It's a very common dermatological treatment. Injections and fillers, or radio frequency microneedling. There's a new Cryo 7 launched recently, where you can store a large amount of programs, and it's the weight was induced, and so it's having a few advantages. It's look like this, and you have here this holder, and here the air is coming out, basically. Here's the air outlet pivots. You also have like this when you're alone while the treatment. You can fix it over the patient, and the cool air is permanently floating on the patient. So you do not need necessarily an assistance. Sometimes it's nice to have somebody to hold and to move with you, and so it's easier for the guy who's treating the patient. Yeah, the programs are in the different selections are very easy to handle. And it's having basically an improved efficiency, separate motor cooling, reducing therapy air pre-cooling temperature. It's very quiet, the quietest ever. And in addition, a new energy saving was built in. So you have a more advanced eco standby mode. Compressor can switch off even during therapy. So it's modern in respect to the energy savings. Anything from your side?
For you important to know is that we provide also a lot of adapters for all the laser companies, like here in the slide is shown. for Alma Lutronic Candela seiner Show, because Zimmer, you have to know, Zimmer is the world market leader in cryotherapy. So what we can is cold air. This is and everyone, if we are on a lot of congresses or exhibitions, and sometimes some people came and said, "Oh, I need a Zimmer." Okay, Zimmer, this is our name of the company. No, we need the cryo. So I think cryo is the most popular device of Zimmer, and we provide also a lot of laser adapters for all the companies, and we have a lot of cooperations with these laser companies. That's why the cryo 6 or 7 is well known in the whole world.
Yeah. So. And you can adapt it with those different laser
This is
types.
also for the practitioners. This is a very big advantage, because sometimes laser, especially hair or tattoo removal or other kind of laser treatments, need a little bit time, and so they don't need any medical stuffs beside them. That's why we offer a lot of adapters. You can do laser treatment and also cold air at the same time. That's the big advantage.
Yeah. Adapted to many firms. Okay. Example treatment recommendations: laser face tattoo, fan level 2 to 4, laser body or tattoo, fan level 5 to 7, and for the photodynamic therapy, for the treatment of sun damages on the head, you do fan level 6 to 9 to reduce the pain, because it's very painful, as you know. Indications: you have more in the EU than in the US. In the US you have the minimized pain, thermal injury during laser, and for temporary topical aesthetic relief for injections. And in the CE certification from the EU is acute and chronic painful conditions of the musculoskeletal system, rheumatic disease, tendinopathies, acute inflammation, pain in the lower back, procedure-related pain, knee, hip, spinal, shoulder surgery, peri-procedural pain in dermatology, as I mentioned, in photodynamic therapy or laser therapy, chest drain removal before or during injections and aspirations, spasticity and pain connected with neurological disorders. So this is the certification in the EU. Contraindications, like the other one, it's all the same. We do not want to treat any patient who's having systemic connective tissue or vasculitis or those stuff. Otherwise, it's very safe. Okay, that was the cryo. Do you know the cryo? And you all use laser systems in your offices? You do not have any lasers? Okay. Okay. Then the next one is Relift, which is also quite new, because it's new with Zimmer, and I know the device for a couple of months, because it's basically brand new. It's the Relift, it's called. And this is a very interesting device for me, because it's a combination of high intensity focused ultrasound and radio frequency microneedling. So you have those two in one device. And here you have the two different heads with the two different cartilages. And you have basically here the HIFU handpiece and on the other side is the radiofrequency microneedling hand phase. And it's a superb machine for treatments in the face area where you want to have a lifting effect, because that's always hard to achieve. If you want to use fillers, you have to put in a lot of filler to get the volume back. And here you can treat even deep layers of the skin in the fat tissue, and you have different depths from 4.5 millimeters to 1.5 millimeters, where you can do a body shaping in the face very easily and non-invasive. And you use, after you apply the local anesthesia as a cream for 20 minutes or 30 minutes, you start the treatment with the HIFU handpiece, and then afterwards you switch to the radiofrequency microneedling handpiece. And you have those two methods combined in one device, and in addition, a vacuum technology is applied where you suck into your handpiece the area, the skin where you want to treat it, and then you have the suction of the skin into the handpiece, and then you have the treatment. Then you release it again, and you just move on to the next part you want to treat. So you have a diverse range of treatment possibilities that can be tailored to the goal of each patient. You have the combination of this high precision microneedling with vacuum technology and the HIFU treatment. And you have a special customized variety of needleless and HIFU cartridge options, which I'm going to show you in a second. Here you have the radiofrequency micro handpiece, and you have here those different needle types. You have, for example, the 25-pin needles, and you even have very new 36-pin needles, and you just switch them and can easily switch from one needle to the other needle. So you have the needling effect triggering the wound healing process. You have the thermal effect, which is applied over the needles into the skin and the deep area, like the fat and connective tissue. And you have the solution absorption for more deeper and more precise penetration. And you can use it in different steps from 0.1 millimeter to a maximum depth of 3.5 millimeters for high precision treatment. At the same time, you have the bipolar radiofrequency energy that is delivered through the skin penetration and into the specific depth to stimulate the collagen and a wide range of possible energy levels. So you have the handpiece contact, then the vacuum is soaking in basically the skin you want to treat. Then the needle is rammed into the skin, which is, when you use the local anesthetics, is not painful. And then the needles are inside, and then the radiofrequency energy is applied in this area. So with the vacuum, you ensure that you get the desired treatment depth. The microneedles are injected into the skin, and then the radiofrequency is applied, and the heat energy is transferred through the dermis to activate regeneration of collagen and elastin. Here you have a uniform and stable energy, you have a minimal energy loss, less skin surface damage, so you have basically almost no downtime, and you reduce the pain. In the vacuum, it's possible to perform treatments at a precise depth by lifting the skin through the vacuum technology, and that makes the procedures in difficult areas like around the eyes and the temporal area more easy. And there are also two needle types, and the the isolated needles apply the energy in a certain depth, so you have no dermal lesions. You might have a little bleeding, but you also have a short downtime, so it's hard to see anything after the treatment. Or you have the non-isolated needles, which are indicated for epidermal and dermal lesions if you need more energy. For example, in acne scars, which are also superficial, and you want to treat the superficial area in scars also, then I would recommend those needles to apply the energy on the whole body of the needle, so you have more effect. I would not use it in younger or the middle-aged patients where you want to do like a lifting effect. This is really for scars and where you need a lot of energy. You can have some surface crust formation because it's more powerful to the epidermis. And you have a wide treatment area. And usually for the body shaping of, for example, the face, I use the isolated. I like them a lot because you apply it, you go in with the needle, you have a certain depth where you want to apply your energy to induce your shrinking effect and the collagen production, so I like them most. Only when I need a lot of power, I use the non-isolated needles. It's also a very easy setting. There's a shot counter where you can count your shots, and you have the treatment setting, which I show you in the afternoon. There are only 2 or 3 rules you have to think about. Depending on the area where you treat, you must be more careful here than here. You can have more energy here than here, so this is not a problem. And this is very easy to select. And I perform those procedures by myself. This is not, you do not delegate it. And you even can, if you want to increase easily, you have the certain depth. For example, 0.80 is the depth here for the temporal area. You leave it like this. And if the patient is fine with the 100 microseconds, you easily can increase the energy to 200 or 300 microseconds. And then you have more energy and a better effect if the patient is tolerating it. But most of the time, it's no problem. For the HIFU handpiece, what you would start with the HIFU first, you have those cartridges. You can basically just exchange by taking it out and putting in another cartridge, and there are 3 cartridges, or actually 13. This is not available in the EU with the 13 millimeters, very deep. We only use 1.5 millimeters, 3 millimeters, and 4.5 millimeters. And the basic treatment idea is that you start deep with the 4.5, you apply your energy, and then you, like a tower, you go up. Then when you have treated one session, the face with the 4.5, you go to the 3 millimeters and treat a little bit above the basement area, which you treat first. And then for the superficial skin areas, you take the cartilage with the 1.5. In the same session. Yeah. It's just you do the first cycle with 4.5 for the deep area, the basement. Then you treat the first floor with the 3.0 millimeter, and then you finish up the epidermis and the upper part of the skin with the 1.5 in just right away. And you can repeat it after 4 to 6 weeks. Yeah, yeah. That's like wound healing. If you induce wound healing, you always have to wait a little bit to increase it more. And you don't want to interfere in the wound healing if it's too early and the wound healing effects are not finished. You do not take the stitches out before the wound healing is finished. And that's the same principle for me. And you can see here the illustration, what I just told you. Again, you try to treat first with the 4.5 millimeters, the deep subcutaneous tissue above this mass. Then you treat with the 3 millimeter, the dermis. And then finally, you treat with the 1.5 millimeters, the superficial area, to finish up. And the special with the relift system is that you have this whole transducer, so you do not have to treat the whole section. You really focus your point of interest where you want to have it. And you focus it in 4.5, 3, and 1.5, and it's very selective. So what you can do is the eyebrow improvement. You can very nicely treat here the forehead and the temporal region about the eyebrow. Double chin is a very nice indication. Skin volume reduction, cheek elasticity, skin lift, skin tightening, wrinkle reduction, skin rejuvenation, and the collagen regeneration. And it's really, the patients really like it. It's a superb combination for this difficult treatment, let's say it like this. So the contraindications, again, autoimmune disorders, facial paralysis, then connective tissue diseases, patients with high fever. And patients with fillers, you have to be a little bit careful. You must imagine if you do a filler, how long would you like to wait until you do this treatment? Where you treat the deep area. And there is no data available, but usually a filler is lasting maybe for 1.5 years, maybe 8 months. It depends on the filler itself. And I would be very careful in at least for 6 to 8 months after a filler treatment to treat this with this combination therapy, because you might affect the filler and destroy it, however. So you should always ask if there in the area which you are treating, is there any filler? And if the patient is saying yes, then you have to think with the patient together when you want to start with the treatment and what's, in your opinion, a good time point to start with. And I would at least 6 months. You can try it, maybe it's okay. But you can destroy some filler with those treatments. And I would just discuss it with the patient and see how the patient is reacting and what the patient is thinking too. And I would wait something between 6 months and 12 months. But I also would take the patient to decide it together with the patient, that you have also the patient's decision. Okay, a little bit careful of all in keloid type skin, of course, yeah, but this is very rare. Usually the healthy people come and ask for these cosmetic treatments and not the very sick patients, because they have other problems, in my opinion. Yeah, anticoagulation treatment, malignant tumors, again, children, of course. Herpes patients, if you treat here in the perioral region, you might induce a localized herpes infection. I have never seen it so far, but this is the only thing I also would consider. No, bleeding disorders, cardiovascular diseases, kidney, cardiac pacemakers, metal stents, blood pressure issues, diabetes. Yeah. And here is again as I said, the first cycle is with the 3 different stages with the HIFU, and then you just switch the device. You even do not have to stand up, and then you use the RF microneedling. And you get the 10 pin, the 25 pin, and what's new for the body treatment, if you want to go even deeper, you can use a 36 pin. And we want to have more effect for bigger or larger areas. And we recently did a training, and the only thing with the HIFU is that you have to spare some regions of the face with the HIFU. So with the first cycle, you want to spare this triangle with the nerves here lateral of the eyebrow. You just mark it before you start the treatment. And here, this triangle in the nasolabial fold, also because of the nerve issue. This area, in the chin area here, and the neck area, and the skin area is no problem. Only exclude with the HIFU those 2 areas. So you do your 3 cycles in this area with the HIFU, 4.5 millimeters, 3 millimeters, 1.5. So you have the tower technique for the whole skin area and the deeper tissue going up. And then you just switch, you put the handpiece back, and then you do the microneedling and go over the same area again. And with the microneedling, you also can do these areas, because you just reduce the needle size to 0.8 millimeters. For the forehead and the perioral region, you use 0.8 millimeters with this microneedling, and all the other, the cheeks, you use 1.2 to 1.6 millimeters. It's that simple. And the effect is huge. And you sit there and you just switch the handpiece, and you have to be a little bit patient and just do it. It's really very, very, very nice effects. Okay. This was the relift combination HIFU with radio frequency. And the downtown time is rare. So if you have like any activities on the weekend and you do it like the mid of the week, you are already ready to go out the next day or the day after. So the downtime is very short. And this is the wanted video from before. This is the radio frequency handpiece. And this you use the 10 and the 25 you use in the face, and the 36 you use for larger areas, for example, the abdomen or the body. This is showing the insulated, my favorite. Apply it locally, and the non-insulated, where you have the full power and you might get epidermal crusts or involvement, where the downtime might take a few days longer. It's not bad like a cutting, but at least you can see it. And this is for me more for scars type indications. These are the cartilages, where you have here the treatment area. So you always have to look a little bit on the scale here, and then you apply. And this is the last session. No? You start deep and go up. And you have really impressive results. It's one of my new favorite machines I like. So, any questions so far? Something else? Coffee time or a break, or what is? Okay, the last one. The remodel is the last one. It's also a radio frequency device, which is supposed to make a nice volume immediately, and which is you do during the day, and you can go out with increased volume at the night. This is, I think, the basic explanation, if you agree. And this concept is basically you also have a vacuum to increase blood circulation and lymphatic drainage. You have the radio frequency for the skin rejuvenation and cellulite improvement. And in addition, you have the third large technology is the low laser level for the fat layer reduction. And so you have basically a combination radio frequency, vacuum, and low laser to improve to a full body transformation. And for me, the basic effect is the volume induction. So you have the hand pieces, you have also the display. You have different hand pieces for the different areas. This one, the big one, is for the body treatment. For larger areas, then you have here another for the body treatment when you need a more rounded appearance. Then you have here those for the face, the different devices. And you have 2 megahertz alternating current radio-free signals, and I mean that is inducing heat. It's really very hot, and if you measure the heat on the skin, it's like 40 degrees on the skin. Deeper, it's like 60 degrees in the fat tissue. So you have an effect, and that is basically how it works. So you have really heat above or around 60 degrees Celsius in the tissue to induce collagen-rich dermis, and it's immediately denaturize the proteins to contract the fibrils and thicken it. And then you have the inflammatory cascade in response to the heat, and then this is inducing new collagen formation and finally inducing the skin looking firmer, tighter, and more useful, and you have a really very nice volume effect, which is rapidly induced, and as I said, you do it in the afternoon and go out for a party. And you have this radio frequencies, you know it from several years with different laser treatment and ultrasound and micro needlings and all those stuff. And what is the big difference is that you have an applicator that is connected to the radio frequency device and is transmitting this energy or the heat into the deep layers of the skin you want to treat in the face or any body region. And this energy generates that the tissue is heated up then 60 degrees inside, and on the skin itself you also still have like 40 degrees. And you induce the metabolism of the fat cells to melt them. The heat also induces the collagen fibers to contract, which is additionally tightening the skin. And also the metabolism in the connective tissue is accelerated and stimulates the production of proteins and smoothness of the complexion, and it's reducing the wrinkles. And the skin appears to be smoother and plumper. And here you can see on those microscopic pictures that these are the adipocytes, and the low level laser, let's say it, with only 658 nanometers, they are shooting like little holes into the adipocytes. and via those holes, the fat is going out of the cells, and the fat cells are shrinking. And so the effect is reducing over all the body circumferences and reduces edema, and is basically also reducing the fat cells size of the adipocytes. The vacuum, which is also included, is lifting the skin to increase the local blood flow circulation and a kind of lymphatic drainage. And you have a selected area which you can safely treat, so you do not have to care too much about side effects. It's a very safe method, or you have the roll technology, where the vacuum assisted motor is rolling with those two device types here, the skin inside. And this roller you use for the bigger areas, where you just go like a roller over the abdomen, and where you easily can treat the bigger areas of the body. So here you have the handpiece. You can select the vacuum. You can select the radio frequency output. Here you can see the selected handpiece you can choose. And here, for example, this round one is very good for the abdomen. It's you always treat it in the direction of the digestive system. So you go, if the patient is in front of you, you go clockwise like this. And so you are treating in the direction of the digestive system or the lymphatic system. You just keep moving the handpiece during the treatment to avoid that it's getting too hot. And you recommend basically about 4 treatments for each area, depending on the patient, so 4 times. So you have a handpiece for the terminal handpiece for the face. Then you can treat the décolleté. You can treat the arms, abdomen and back, the thighs and the calves. And the indications are, as I already said, body toning, cellulite treatment, face lifting, so the volume effect, and the contraindications are still the same. So we skip this. Oh, this was the last slide, because I can't move. Sorry. A quick recap. Yeah, good sign to finish up. So, quick summary: comfortable, non-invasive. You have the variable handpieces for different treatments and treating even larger areas of the body. Also a combined technology, hygienic and effective protocols, which are very easy to select and very safe in the handling. Here you have a patient after 4 times. This was before and after. And even here, these back areas are very good to treat. And 4 sessions, 5 sessions is the average of treatments. As I said, you have the radio frequency, the low-level laser, and the vacuum. 60 kilograms, so it's not too heavy. It's very easy to move and to move it from room to the other where you want to have it, basically. Okay, that was the radio frequency, the remodeling. Any questions? Then I would suggest that we make a little break, if that is in accordance with your impression. Or is anything to add?
Yes, let's make a picture, all of us.
Okay, yes.
And after we can eat.
Okay, and then in the afternoon you are more than welcome. We have, I think, two models coming.
Yes.
And what?
Go upstairs.
Yeah, upstairs.
After lunch.
Yeah, and all the devices are there. And what I like is that we maybe show you a little bit, but if you want to do some hands-on and want to get a feeling, you are more than welcome to practice by your own.
Perfect.
Yeah, okay, thank you so much. It's a pleasure that you all came. Thank you.